taking a chance. Telling me to dance, taking a chance.
No matter where you are in your experience with cancer, taking care of your mind is as important as taking care of your body. This might be hard to do, but here's some information that can help. Anxiety, depression, social isolation, PTSD, and other kinds of mental health distress are common in people with cancer. You might feel sad, isolated, afraid, angry, anxious, hopeless, or unsure of your meaning or purpose in life. Distress can come and go at any time. In this video, we will clear up the most common myths about distress. Myth number 1. Mental health distress goes away after treatment is over. In fact, whether you are getting treatment or not, you may feel scared or alone. If you finish treatment, you may not see your cancer care team as often. Family and friends might assume things are getting back to normal. However, social isolation or fears of cancer coming back can make distress a long-term side effect. Preparing to cope with distress, even after treatment, can help. Myth number 2. There's nothing I can do that will help distress. In fact, there are things you can do to help cope with distress, especially if you feel like you're stuck because you're not feeling better. Find someone you can talk to. Many therapists use cognitive behavioral therapy, or CBT, to help identify and reframe thoughts that can lead to feelings of hopelessness or helplessness. Learning new coping skills with CBT can help you adjust any negative thoughts or feelings common with depression and anxiety. And for many people, the benefits of CBT continue for years, even after a person has stopped therapy. Support groups are another option if you want to talk to people who have gone through a similar experience. Ask a healthcare provider about medication options. Antidepressants have been shown to help with depression, anxiety, and sleep problems. There are different types of antidepressants, and they can take a few weeks to start working, so don't get discouraged. Sometimes there isn't one single fix. Something might even work one day but not the next. The more coping methods you have ready, the better prepared you'll be when you need them. Yoga, massage, imagery, writing, music, and pet therapy have shown to be helpful. Even getting outside for a walk can make a difference. Find connection, community, and meaningful relationships. Know that some days will be better than others. Try to take it one moment at a time, and it's okay if you don't feel positive all the time. Feeling what you feel and not ignoring it can be key to healing. Remember, mental health is important to your overall health. You are not alone. The American Cancer Society is here to help with resources and information day or night at 800-227-2345 or cancer.org.
Hello, hello, hello. Welcome to Shorter Tea Tuesdays. It is time for the Cancer Care Series. I hope that you were able to catch some very useful information from the American Cancer Society. Just kind of eliminating some of those myths, because there are times where things come out and we feel like, oh, that may be true. There's a variety of things. But hey, so welcome to Shorter Tea Tuesdays. I hope my voice is here and strong enough for you to be able to hear me, because hey, I've been busy and I'm almost borderline exhausted. So, but without further ado, I do want to share a resource with you, besides the one that you just heard from the American Cancer Society. But I want to share this one, which is Cancer Diet. Now, this is not my book, but I talk a lot about this word right here. We got to stop saying the diet part, because we're not living to die, right? We're living to we're eating to live. But anyway, so this book is Cancer Diet for the Newly Diagnosed. It's an integrative guide and cookbook for treatment and recovery. I did put her information on here who wrote this wonderful book. And so, if anyone's going through a current cancer journey, or if you are in the midst of journey or just recently diagnosed, it doesn't even matter. If you've never been diagnosed, this is a very useful book for you to take part of, because eating well is essential. Anytime that we're facing a cancer diagnosis, we need to make sure that we're doing what we need to do before we even are diagnosed with cancer. We need to make sure we're feeding our bodies with what is needed for us, right? I know everyone's not going to be healthy and all those different things, but if we start to change the way that we interact with our food and our relationships with food, it would make our lives a lot less stressful. We'll put it that way. But anyway, so this has different recipes in here as well, and then it also starts off with just a healthy approach for doing cancer treatment, because when you're going through your cancer treatments, honey, it's not what you anticipate. Even when the doctors or your treatment team tell you and explain to you this is what to expect, this is what's going to happen, um, it still doesn't feel like or you're pretty much prepared for what's about to happen to you, your your mentality and your physical makeup of your body and everything else that comes into place. And so it's important for you to maybe just look at food a little bit differently. You can still enjoy the things that you enjoy, but I think you'll probably want to make some changes, and just be a little bit more mindful, right? When we learn new things and we are more mindful of what we're doing, then we take a different approach towards things. Sometimes when it's really not in our mindset and we're kind of like, I don't really care. You do care. We just have to kind of bring it to the front to where that information is with us at all times, right? So this is a cool book. You can go and check this out. Look her up on Amazon or Barnes and Nobles or any of those other books that's out, because this was just recently published in 2022. And so go and if you can screenshot or take a picture of this book, go and get this book and share it with someone. It has lots of different resources in here that you can try that will help you along any journey that you're on, even if it's not related to cancer. And I will say, for the Read the Tea book club, yes, there is a book club for Read the Tea. We'll drop this in there where you're able to get this book as well and support. All right. So May is Mental Health Awareness Month, right? And be honest, even though it's a month focused on mental health is every day. Every day that you wake up, every day that you blink, breathe, say hi, bye, all of those different things. Mental health is everyday journey. And so when you have a cancer diagnosis on top of mental health, sometimes it can be even twice as hard for you to be able to do what you need to do as a cancer thriver. That's what we're gonna name a cancer thriver. So I want to talk a little bit about mental health. You heard the video earlier in regards to feeling like you're not able to do certain things and just feeling exhausted. Anytime someone is diagnosed with cancer, exhaustion is probably the second word that they say the most, that they're just tired. The best way for me to explain it is you often feel like your battery. You know how your battery on your cell phone, it has those it has the little line there, or the little, however your phone is made, but you see this little tube, right? And so on that tube, you can see if you're feeling full, and then it kind of just goes down, right? And then when you get down to the halfway mark, well, beyond the halfway mark, but when it's getting low, then it starts to say, hey, hey, and then 10%, oh, you need to charge that battery, right? And so that's how it feels for for cancer patients. Like our energy level is just easily depleted. Sometimes it can be anything as simple as walking to the mailbox, right? That takes a lot. Or maybe washing dishes. That can definitely take a lot. Sometimes it can even, if we want to go to Walmart, everybody knows how huge Walmart is, or even a smaller store, that can take a lot. And so keep in mind of the energy that you have. Try to consume some of that energy, not to get yourself so depleted, um, and to break it down into smaller steps or smaller goals, or whatever that you're trying to work on. For instance, if you're trying to clean your house, right, and you usually just clean up everything, get everything together. Well, you may not be able to do that at this moment. You may have to say, well, let me just start with um, washing the dishes, and then I'll take a break, because you may only get halfway through the dishes, or you may wash them but don't feel like putting them up. So, excuse me. So there's different things here that can happen, and so I want you to kind of be mindful of how. Ooh, let me take a little sip. I knew my little voice was gone. Hmm. My little voice is going to try to disappear, but try to break it down into a smaller scale, so that way you're not feeling so overwhelmed about what's going on or what's about to happen. I will say that we have to also remind ourselves that, even though, sorry, I was trying to see if that was going to work. Even though we are in the midst of this journey, how do we want to get to the other side, right? And I say other side as in other side of recovery, other side of um, your treatment. Because if you start to feel like, hey, everything is just feeling overwhelming, and it's just, I don't care anymore, if you just start giving up hope, that's not going to help. So if we start to focus on, I can get through this. What can I do to help me get through this journey, right? Then we have to start connecting ourselves with resources, because your mental health is very important. If your mental health starts to decline while you're doing treatment, that's going to be the worst thing almost ever, besides getting sick. And the reason I say that is because when the doctors are talking to you, when your care team is talking to you, even your family members are talking to you, you're not going to be receptive to what they're saying. You're going to pretty much ignore them. You're going to feel defeated. You're going to feel hopeless and helpless. A lot of times when you're going into your treatment centers, they ask you those questions. If you haven't started treatment yet, then you'll keep this in mind, because you'll experience this shortly. They'll ask you those questions. It's probably about five or six or seven questions that they ask you in regards to mental health. If you're starting to feel alone, if you're starting to feel isolated, or do you feel like you're losing hope? I'm just paraphrasing on some of these questions, but they will ask you those questions, because if you start to decline some, then we need to focus on that before we do anything else with the treatment. And that doesn't mean that your treatment is not important anymore, but that means that we need to help with this psychological part before we start working on this um, cancer treatment. So, and the reason I'm explaining all this is because I feel that at times we feel completely alone, and trust me, I've been there. Um, Especially when you're at the house by yourself, you feel like you're alone. You're not able to move like you're supposed to, or you're not supposed to pick up certain things, or you're supposed to be laying down recovering, right? And so I can understand that when you feel like you are alone, and at times those thoughts and things can start to be like a floodgate for your mental health. And once that floodgate opens, I don't know if you've ever actually seen a floodgate opens, but once that floodgate opens, it's 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 like it's really difficult for you to be able to manage to get that closed again. So I encourage you to be able to do some journaling, express yourself through writing or through art, or if you want to pick up a hobby like crocheting or knitting or puzzles. I love puzzles. But do something that will help you to get your mindset prepared. Do something that's going to restore you. And I know that some people are like, well, that's difficult to do, or I don't have time to do this. I have these kids, and or I have this husband, or I have this wife I got to take care of, or I got to do this, I got to do that. You have to be able to put yourself on the map. And when I say daily, I mean daily. Because when you're going through these treatments, they're not going to ask you in regards to what's going on at the home with your wife, what's going on at your home with your girlfriend, your boyfriend, your kids, and all that. They're going to be concerned about how your body is receiving these treatments. So if you're stressed, if you're, they look at your blood level counts. You know, you have labs and things that you have to do. If your blood pressure is extremely too high, or if your blood pressure is extremely too low, you know, there's all these different factors that can play a part if you're just extremely overwhelmed, right? And just going through a mist of things. So I say all this because when you're going on your journey, or even if you're on your journey, do something that you like to do. Find a time, even if it's 15, 20 minutes, do something that you like to do. So even if it's just sitting outside watching the neighbors walk by, or listen to the birds chirp, or just sitting outside, then do that. Even if it's just going to the park and looking at the ducks, or driving around, just driving, just be driving. Depending on, some people like to just drive because you have beautiful scenery. Whatever it is, do something that you want to do. Now, I'll be honest, some things you may not be able to do like you used to do before. So if you're into hiking and rock climbing and all these other things, because of the strenuous of your treatment, right? But at least be able to find something that's going to be relaxing for you, because your mental health is very, very, very vital in the recovery of cancer. Very, very vital. And the reason I also want to share this with you, when you're going through when you're first diagnosed, depending on what treatment center you're in, but most of them should have it. They will have like a case manager or caseworker or care team, depending on, they use different words. But it will be a coordinator that will coordinate you with resources. If she comes in, he or she comes in and they say, hey, do you have any needs at this moment? Do you have, is there anything that we can connect you with? Right then and there, you're going to probably say, no, I'm fine. I have everything. Right? Because that was me. No, I'm fine. I have everything. I don't need anything. Right? I want you to take the time to think about it. So you may say, let me think about it. And if I need something, how can I get in contact with you so that way I can just reach out to you and ask? There are several centers that offer counseling. I strongly, and I'm not just saying this because I'm in behavioral health, but I strongly suggest for you to go through the counseling. Reason being, the individual that you're going to speak with, they don't even know you. All they know is your first and last name and that you've been diagnosed with XYZ, right? It's going to be up to you what you want to disclose to them. And you're probably not going to see them for like years and years, depending on what treatments you're in and all that. But it's good for you to be able to have someone that you can talk to, and possibly relate to about what's going on. Now, why do you say this, Vanilla? I can just get a therapist outside of the cancer center part. I don't need to have somebody all in my business, and then I gotta go. No, the reason I tell you to do this is because cancer is traumatizing. Cancer. Hello, can you hear me? I'll talk a little louder. Cancer is traumatizing. Very. It's trauma. It's trauma from the time that you are diagnosed. It's trauma from from the next step where you call and tell your loved one, your family, whoever that it may be. It's a whole lot of trauma. And then if you have children that are involved and they hear the word cancer, we talked about this before. When we hear the word cancer, what do we associate with? That D word, right? Death. No. So I'm hoping that um, when you hear cancer, is we're going to hear more of, okay, how can I recover from this? There's hope for certain treatments or whatever treatments that are available. What are my, I don't want to say options, because then it make it seem like, well, if I only have two or three options, then that's it. But what treatments are available for me, right? Help me understand what's the purpose of the treatments and how it's going to react to my body. Because they can only tell you so much. They can only tell you so much. So cancer is traumatizing. And then on top of that, after you go through your diagnosis, you also start to feel as if people look at you strange, right? Like, oh, she don't look too good. She look like she may be sick, right? I hate hearing that word. Like, what does sick look like, right? We pass those judgments on to our fellow humankind because we make the assumption of what we see and what we feel. But there are people that are walking around just fine that have cancer and you don't even know it, right? So it's more so of being able to have that understanding that when I'm going through something, I need to be able to talk to someone about it. And so going to counseling, I highly, highly recommend it. While you're in treatment, and I'm saying in treatment or getting ready to start treatment, if you do it within the like the within the cancer center or institute, whatever facility that you go to, it helps if you do the counseling within that setting because it ties on into whatever insurance or whatever billing that they're going to do now instead of you going to an outside source. So I just kind of want to share that part. So use those resources that they are offering you because it's beneficial. Now, if you feel like they haven't offered you any resources, then you need to ask some questions. Do you have any resources for me? What are some something that can help me throughout this journey? You may not even know what it is, but they should be able to offer you resources. Now, everyone knows American Cancer Society. And that's not just to throw any shade to them, but everybody knows American Cancer Society and all the resources that they're able to provide. But there also are other resources out here that are able to help you as well. So make sure that you communicate with that coordinator, caretaker, not caretaker, case manager, whomever, whatever title that they may have, and let them know your needs. Even if you don't have a need right now, think about it because something may come up and you say, hey, it could be something as simple as I don't have the gas to get to my treatment. I don't have the money to pay for the copayment for the next treatment because some a lot of that stuff costs and you have to pay a copayment or whatever different things every time. So if you need help, financial help, or if you need there's also resources out here where you can while you're going through treatment, you're sitting there for hours just sitting. And so there's resources out there where they can give you a tablet to keep yourself entertained because maybe everybody doesn't have a tablet. Now I know that may be surprising for some, but everybody doesn't have a digital device. So just make sure you ask for those resources. Make sure that you do the counseling be able to talk to someone about what's going on um, because it is very traumatizing. Even after or even throughout your treatment, if you feel like, I think I'm starting to regret some things, or I think I need to talk to somebody about some things that's going on with me. It's not too late for you to seek therapy. I'm just saying, it's not too late. Even if you've been out of treatment for a year or 2 months, it's not too late for you to seek therapy. And a lot of times, the therapy is more so to, I don't want to say rejuvenate, but it's just more so to help you understand that these things are not always your fault, right? Because, and I would speak, I can only speak from my experience because I'm Vernelia, right? But I can't hold myself in guilt and frustration because I didn't have a child earlier time in the age, right? Or I'm not able to produce for my husband, right? So these are things that have occurred in my mindset. And there's been several times where I see so many different pregnant women. I don't know. One time it was like 8 women in one day, and I got frustrated. I was like, if I see another pregnant one, I'm gonna scream. And I sent that to Reggie, my husband, and he said, just calm down, don't think about it. But to me, I feel like, "Ugh, I'm missing out. I can't do that. I want to have that experience, right?" And all of that plays a toll in your mindset. It really does. It plays a toll in how you feel about yourself, as far as being a wife, a spouse, a partner, whatever your role may be. I'm just sharing my experience. And so at the time when I was asked, do you want to have counseling? I just said, no, I don't, no, I'm good. I don't need it. Right. And I regret it. I regret that I didn't go ahead and jump on that opportunity because of all the different thoughts and things that started to come into my mind. Yes, some people can cope with things differently. Some people can manage things with, you know, all different types of ways of managing things. But at times, some things are triggering. Like I said, seeing all these women pregnant, it can be triggering. Seeing a baby can be triggering, right? Um, there's there's even times when, and I'm going to share this because I'm a transparent person. But a friend of mine, we were pregnant at the same time back in 2008, right? Her lovely son. He's a teenager now, and so literally I've lived through him because it's like if my child would have survived, um, I would have a teenager, right? And so all those things play a toll in your mental health. And I say that because I know that I'm not the only person. And when you understand that you're not the only person going through certain things in life, then you can be more open to be able to discuss it. There's no need for me to be ashamed. There's no need for me to be embarrassed, um, or anything, because my journey is my journey. My journey's not supposed to be like everybody else's. So the journey that I've been given, I have to be able to adjust to it the best way possible. So I hope that this little segment that I have provided for you for Cancer Care Series has been enlightening, because mental health is important, not just in the month of May, not just in the week of October, but every single day you have to do something for you. There are times when I'm dog beat tired, right? Dog beat tired. And I have to say, I can't do anymore. I gotta go sit down. I gotta go take a break. I just want to sit. I don't want to look at another computer. I just want to go outside and listen to Zeus and Athena, my little birds. Just want to listen to them sing and argue and fuss and do all the different things that they're doing for their little kids, right? Um, so you have to remind yourself, because sometimes we get into the gear of just going, 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 going. And like I explained at the beginning, when we're that battery and that battery life starts to go down, 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 we have to remind ourselves, okay, I'm depleting all of my energy and my resources. So I got to do something better. So I hope that this has been useful for you. Don't forget to get you this lovely book here. It has all types of resources in here. It's like how many pages is it? 157 pages of delicious greatness in here. So go ahead and get this book. It will be in the Read the Tea book club. If you want to join the book club, you are more than welcome. You can go to my website and click, well, my website is shirleytllc.org, and you can join the book club there. The Read the Tea book club is for adults only, but there is a children's book club that's called Wiser Book Club. So, and that's on a different scale. So I just kind of want to let you know about that. Yeah, check out this book, share it with someone. You never know, you may find something useful. And I want to, I think next month, what I'll do is kind of talk about different foods that are healing for us, because that's important. If we're not going to eat right and change up our eating habits, then what are we doing? What are we doing? We're all on borrowed time, right? So you better use that borrowed time wisely, because when it runs out, it runs out. But we're hoping that it will, that you will sustain as long as possible, Lord's will, and then we'll pretty much go from there. So if you have any questions, you can always reach out to me. My email is sharethetea@gmail.com. If you would like to be a special guest on Cancer Care Series, it's always the third Tuesday of the month. I'm more than welcome to. It's open to anyone, nurses, doctors, care survivors, caretakers, whomever, that would like to come on and just talk about the Cancer Care Series, and be able to share some resources or information that you may have, and want to share with the community. All right. Well, I thank you for listening to Strategy Tuesdays. Stay tuned for next week. We will have a special guest that's going to share her journey, Miss Amy Taylor. She's she's excited to be on the podcast, and so we're welcome to invite her in. And if you guys ever have any questions, please reach out. Don't forget to follow me on Charlotte T with V is my social handle, and I'm on everything except for Snap of the Chat. But you know where all the rest of them are. So remember, I remember the slogan: be intentional, be insightful, and definitely be what? Yep, you got it. Be impactful. I'll talk to you next week. Stay blessed. Bye.